Managing and treating.
Altered mental status involves several steps to ensure prompt and appropriate care. 1. Assessment. Quickly assess the patient's vital signs, including heart rate, blood pressure, respiratory rate, and oxygen saturation. Perform a focused neurological assessment, including level of consciousness, pupil size and reactivity, and motor responses. 2. Airway. Ensure a patent airway by positioning the patient's head in a neutral position and performing necessary interventions, such as suctioning or providing supplemental oxygen, if needed. 3. Breathing. Assess the patient's respiratory status and intervene as necessary to maintain adequate oxygenation and ventilation. Administer oxygen via nasal cannula or mask if the patient is hypoxic. 4. Circulation. Monitor the patient's cardiac rhythm, blood pressure, and perfusion status. Administer intravenous fluids and vasopressors as needed to maintain hemodynamic stability. 5. Glucose. Check the patient's blood glucose level to rule out hypoglycemia, which can present with altered mental status. Administer dextrose if indicated. 6. Toxins. Consider possible toxic exposures or drug overdoses as potential causes of altered mental status. Obtain a thorough history, including medication use, recreational drug use, and environmental exposures. 7. Infection. Assess for signs of infection, such as fever, tachycardia, and focal neurological deficits. Obtain cultures and initiate empiric antibiotic therapy if infection is suspected. 8. Neuroimaging. Consider obtaining a head CT scan to evaluate for intracranial pathology, such as hemorrhage or mass lesions, if indicated based on clinical findings. 9. Consultation. Involve specialists, such as neurology or critical care, as needed for further evaluation and management of the underlying cause of altered mental status. 10. Monitoring. Continuously monitor the patient's neurological status, vital signs, and response to treatment. Reassess and adjust interventions as necessary to optimize patient outcomes. Remember to prioritize rapid assessment and intervention to identify and address potentially life-threatening causes of altered mental status while simultaneously investigating and treating underlying etiologies. Communication with the patient, family members, and healthcare team members is essential throughout the management process. Thanks for watching, EMN Medic, signing off.